of Delhi. He has done health administration, including hospital administration course (DNB). He is a senior consultant health Indian Railways New Delhi. He has 40 years experience in health and hospital administration. He has several fellowships, awards, recognition, memberships from international and national bodies. He has is a long list of achievements and recognition. So I welcome Dr. Rajiv Jain on behalf of AUSD. He's also our senior vice president, but uh, I will request him to start his presentation.
Thank you, Dr. Sriniket. I don't know how much I deserve the words you said, but let's concentrate on OCU Healthscapes. OCU Healthscapes, as we always have it at 6:30 p.m. on last Friday of the month, and today on 25th of June 2021, we have the last Friday of the month, and at 6:30. So OCU Healthscapes consists of three portions: OCU for occupational, health for health, occupational health. Scapes is the landscape of occupational health that is visible to us. So we should also understand that this episode or this series is concentrating on environmental and occupational health issues and issues which are important, which have happened in the last 1 month or are likely to develop in the next month or so. So let's begin from the beginning. Next slide, please. We will start from India and we'll see the landscape of environmental health in India during the last 1 year. So the major component has been the climate change. Rising temperature is an important issue in India. India experienced a warmer than usual winter, monsoon and post-monsoon seasons in 2020. In 2020 was the 8th warmest year on record. 2016 was the warmest, followed by 2009 and 2017. 12 of the 15 warmest years were recorded during the past 15 years, that from 2006 to 2020. From 2011 to 2020 was the warmest decade on record with anomalies of 0.34% above average. Annual average temperature, the 2020 annual mean land surface air temperature for the country was 25.78 degrees centigrade, which was plus 0.29 degrees centigrade above the 1981-2010 period average. This indicates if you see the bottom graph, how the temperature has been rising. This affects entire livelihood, entire environment, and entire ecosystem in the country. Next slide, please. Climate change has been disastrous for India. An average of around 3.73 million people a year were displaced between 2008 and 2020, the majority by flooding during the monsoon. India is also prone to other sudden and slow onset hazards, including earthquakes, tsunamis, cyclones, storms, surges, and droughts. If you look at the bottom, each year, how many displacements have occurred due to disasters and conflict? If you look at the table of the bar diagram, in 2012, 9.1 million, in 2008, 6.7 million, and 2019, 5 million, and in 2009, 5.3 million, and in 2020, 3.9 million was the displacement number. Next slide, please. Going along the climate change, we see significant weather events in 2020. 21 major weather events were claimed, over 1374 lives in 2020. Heavy rains, floods, and thunderstorms were responsible for over 51% of the deaths. Lightning was responsible for 33% of the deaths. And if you look at the map of India, you can see how significant majority weather events have claimed lives. all across the country, especially in the central India, western India, and northeast India. Next slide, please. Since 1971, India has recorded 38 cyclonic storms in November, followed by 15 in May. And if you look at the figure at the bottom, you will understand how devastating the effect has been. In the 1971-1980 decade, 28 events, 1981 to 1990, 25, 91 to 2023, 2001 to 2010, 18, and 2011 to 20, 33 events. So it has been worsening. Next slide, please. If you look at the state of agriculture, farmers' unrest just a year before the target of doubling farmers' income, India recorded 165 major protests across 22 states and union territories. In 2007, the country saw 34 major protests in 15 states. This is maybe due to economic and farm policies, farm infrastructure, land acquisition, insurance and loan waivers, others, and procurement and fair price issues. And if you look at the bottom, 5 times increase in farmers' protests between 2017 and 2020-21. This is also part of the effect of climate change. Next slide, please. Then we look at the state of air, PM 2.5 burden. Over the past 2 decades, deaths attributable to ambient PM 2.5 in India has increased 2.5 times. If you look at the bottom, the graph, you can understand how deaths attributable to 2.5 has risen sharply from 2,79,000 to 9,79,700 in the year 2019. An average annual population weighted PM 2.5 has risen from 71.5 to 83.2. Next slide, please. State of water. Assam with 16 glaciers, Arunachal with 13 glaciers, and Jammu Kashmir and Ladakh with 10 glaciers face the maximum risk in case of a disaster. India has 39 glaciers and water bodies that have recorded more than 40% increase in water levels since 2009. At the bottom, you look at the figures, same figure graphically, in the Brahmaputra basin, in the Ganga basin, and in the basin. Indus basin has shown the maximum. Next slide, please. We look at the state of energy. If you look at the rooftop solar, the gap between the target and achieved has only widened over the years. If you look at the target shown in red, and achievement reported in the year in MW has been in yellow. So you can see the difference between the target and the achievement. This has been widening all through for the last 6-7 years. Next slide, please. Continuing on the state of energy, the drained energy, India is lagging in both solar and wind energy, which account for over 90% of its 2022 target. If you look at the solar power, target achieved is 39%, wind power, target achieved is 65%, small hydro projects, target achieved is 96%, biomass power, target achieved is 103%. So except for biomass power, all other power projects, energy projects have lagged behind, especially solar power and wind power. Next slide, please. If we look at the state of cities, there is sewage overload. Only 28% of India's sewage gets treated. This is because the current installed capacity is only 44% of what the cities currently generate, and even these plants remain underutilized. If you look at the bottom of the graph, in 1978-79, there were treatment capacity installed 2758, and then it has gone up to 31,841 in the year 2021. If you look at the sewage generated from 7,000, it has gone up to 72,000, more than 10 times. And the treatment is lagged behind, only 31,000 is treated. Next slide, please. Next slide, please. Now, if we look at the state of cities, what is the ease of living index 2020? This is the second edition of index that was launched in 2018. The current index has seen a significant change for the last index. Most noticeable of it is the inclusion of citizens' feedback to understand the livability of Indian cities. The report, which was released along the Municipal Performance Index. Quality of life weightage 35%, economic ability is 15% weightage, sustainability is 20% weightage, citizen perception survey is 30% weightage. And in this, best capital city has been Panaji in quality of life, and worst capital city is Srinagar. If you look at the economic ability, best capital city is Bangalore, and the worst capital city is Kohima. If you look at the sustainability point of view, best capital city is Shimla, and worst capital city is Imphal in Manipur. If we look at the citizen perception survey, best capital city is Bhubaneswar, and the worst capital city is Delhi. And it is used to assess the role of administrators. If we look at the 4 parameters, quality of life, economic ability, sustainability, and citizen perception survey, no single city, capital city has been able to be topping or in any in combined 4 areas. All components have different capital city. That is also worth noting. Next slide, please. If you look at the state of unemployment, there have been mounting delays. Mahatma Gandhi National Rural Employment Guarantee Scheme saw an unprecedented peak in demand after the national lockdown last year. Payment delays, though, continue to mar the centre's flagship rural employment program for rural India. 56% of the payment delays were reported in just 5 states. In 2021, 13.4% of the payments in Jammu Kashmir was delayed, followed by Bihar 12.1% and West Bengal 11.8%. 59% of the late payments in Manipur was delayed by more than 90 days. The national average is 14%. So there is a serious issue in actually generating employment to ensure livelihoods. Next slide, please. If you look at the state of development, there has been slow progress. India ranks below 4 South Asian countries in terms of sustainable development goals. If you look at Bhutan is 80, Sri Lanka is 94, Nepal is 96, and Bangladesh is 116, India is 117. Only Pakistan is after India 134 rank in terms of SDG attainment. Next slide, please. If we look at the biomedical waste in terms of state of waste, India still disposes only 12% of its hospital waste without any treatment. Bihar and Karnataka fared the worst. Average monthly COVID-19 biomedical waste, if you look at 2,02,000 in May 21, and in January 20, it was 1,01,000. And biomedical waste in terms of per day in kgs is shown in the red and the green boxes. If you look at biomedical waste generated is in red box, and biomedical waste treated is in green box. And in the orange, in the yellow circle, there is BMW, which has been which gets treated. So in terms of percentage, so only 88% is treated, 12% is not treated. Next slide, please. Now, having reviewed the state of environment, we come to another issue which is important for all of us to understand. It is the issue of e-waste and how it affects the health of millions of children across the world. World Health Organization warned all the people, all the countries, all the governments of the world, and told that soaring e-waste affects the health of millions of children. The first WHO report on e-waste and child health calls for more effective and binding action to protect children from growing health threats. Effective and binding action is urgently required to protect the millions of children, adolescents, and expectant mothers worldwide whose health is jeopardized by the informal processing of discarded electrical or electronic waste devices, according to a new groundbreaking report from the World Health Organization. The report is titled Children and Digital Dump Sites. With mounting volumes of production and disposal, the world faces what one recent international forum described as a mounting tsunami of e-waste, putting lives and health at risk, said Dr. Tedros Adhanom Ghebreyesus, WHO Director General. In the same way, the world has rallied to protect the seas and their ecosystem from plastic and microplastic pollution. We need to rally to protect our most valuable resource, the health of our children, from the growing threat of e-waste. As many as 12.9 million women are working in the informal waste sector, which potentially exposes them to toxic e-waste and puts them and their unborn children at risk. Meanwhile, more than 18 million children and adolescents, some as young as 5 years of age, are actively engaged in the informal industrial sector, of which waste processing is a subset. Children are often engaged by parents or caregivers in e-waste recycling because their small hands are more dexterous than those of the adults. Other children live, go to school, and play near e-waste recycling centers where high levels of toxic chemicals, mostly lead and mercury, can damage their intellectual abilities. Children exposed to e-waste are particularly vulnerable to the toxic chemicals they contain due to their smaller size, less developed organs, and rapid rate of growth and development. They absorb more pollutants relative to their size and are less able to metabolize or eradicate toxic substances from their bodies. Next slide, please. Worldwide, up to 12 million women may be at risk of exposure to toxic e-waste and recycling activities. Next slide, please. Millions of children around the world are exposed to more than 1,000 toxicants from e-waste and related activities. So don't waste your future. Be wise about e-waste. Next slide, please. To limit your e-waste, follow the 3 R's. What are those 3 R's? They are reduce, reuse, and repair. Reduce, reuse, and repair. Next slide, please. Become an e-waste community champion. How you can get involved in reducing e-waste? There are 6 ways. 1, petition your local government for designated e-waste collection points. 2nd, organize an e-waste repair workshop. 3, ask your school to run sessions on the dangers of e-waste and ways to prevent it. Number 4, organize educational sessions to learn about dangers of e-waste. Number 5, invite your community to participate. And number 6, create a local e-waste recycling network and collection days. Next slide, please. How to dispose of e-waste in healthy ways. When your favorite electronics become waste, they contain valuable and dangerous elements. Only replace your electronics when they break, not when they go out of fashion. 2nd, educate yourself and others on the dangers of improper recycling. 3rd, organized e-waste collection days in your community. 4th, recycle old electronics in designated bins or via take back systems. And number 5, practice the 3 R's, that is reduce, reuse, and repair. Next slide. Informal e-waste recycling may cause adverse health effects in children. How? They adversely affect birth outcomes. They damage the DNA. They change to immune system function. They bring impaired cardiovascular function. They also lead to impaired neurodevelopment and behavior. Also, it leads to lung function and respiratory effects, and also changes in thyroid function. And last but not the least, increased risk of diseases later in life. So there are number of waste recycling that affects adversely the health of children. These health effects can have lifelong impacts. Next slide, please. Many toxic substances are found in everyday electronics. Mobile phone contains silver, platinum, copper, gold, and cadmium. Computers also contain copper, gold, cadmium, lead, mercury, nickel, and bromine. Processes used in informal e-waste recycling can release additional toxicants that accumulate in the food chain. Electronic items must be recycled appropriately to protect people and the environment from dangerous contamination. Next slide, please. Children are exposed to e-waste toxicants through 4 major pathways. Number 1 is skin exposure from contaminated toys, corrosive substances, and take-home exposure. Second, by inhalation of contaminated air. Third, by ingestion of contaminated food, water, breast milk, soil, and dust. And last, number 4, transplacenta exposure. Next slide, please. Informal e-waste recycling can pollute and contaminate all air, soil and dust, water sources, and groundwater. This kind of recycling includes open burning, heating, and acid bathing of old electronics. From the environment, e-waste toxicants find their way into people, for example, skin exposure, drinking water, food crops, fish and shellfish, livestock, and eggs. Next slide, please. So you can understand how e-waste affects the health of individuals, whether children or adults, more for children. Another important issue which has gained importance in the last one month has been the One Health High Level Expert Panel, that is OHHLEP. There were 26 international experts have been appointed as the One Health High Level Expert Panel, recognizing the complex and multidisciplinary issues raised by the interface of human, animal, and ecosystem health, that is One Health, that require enhanced coordination and collaboration among sectors and agencies, nationally and internationally. The Food and Agriculture Organization, FAO, the World Organization for Animal Health, that is OIE, the United Nations Environment Program, UNEP, and the World Health Organization, WHO, which are all 4 partners, launched on 29th March 2021 a joint call for expression of interest to constitute a One Health High-Level Expert Panel, OHHLEP. From over 700 applications received, 26 international experts were appointed in May 2021 to serve as members on the high-level One Health Experts Panel. The panel is multidisciplinary with experts who have a range of technical knowledge, skills, and experience relevant to One Health. The OHHLEP will provide guidance on One Health related matters that support improved cooperation among governments. It has an advisory role to the partners and is expected to support their provision of evidence-based scientific and policy advice to address the challenges raised by One Health. The areas of focus of the OHHLEP will be subjected to regular review by the partners. Initially, the OHHLEP will focus on 2 issues. Number 1, providing policy relevant scientific assessment on the emergence of health crises arising from the human-animal ecosystem interface, as well as research gaps. And number 2, guidance on development of a long-term strategic approach to reducing the risk of zoonotic pandemics with an associated monitoring and early warning framework, and the synergies needed to re-institutionalize and implement the One Health approach, including in areas that drive pandemic risk. The OHHLEP's advice will contribute to enhancing strategic orientation and coordination and to providing high political visibility on the subject of One Health. Next slide, please. These are the individuals appointed on the One Health high-level expert panel. First is Biku Bakti Adisamito from Indonesia. He is a professor in health policy in the University of Indonesia. Second is from UAE, Salama Al Muhairi. He is director of veterinary lab division of Abu Dhabi Agriculture and Food Safety Authority. Third is from USA, Casey Barton Baravish, personal capacity, and as an individual, he has come from Guinea, Konarki, Pepe Biligogi, who is a technical consultant in Project Redice, World Bank OOAS. From Kenya, Salomi Bukachi, associate professor, Institute of Anthropology, University of Nairobi. From Argentina, Natalia Casas, National Zoonosis Coordinator, Ministry of Health of Argentina. From Colombia, Natalia Cedil Becerra, lecturer and researcher, University de La Salle, Bogota. From Canada, Dominique Charon, who is a vice president, programs and partnerships, International Development Research Center, Ottawa. From India, Abhishek Chaudhary, who is an assistant professor in the Department of Civil Engineering in the Indian Institute of Technology, Kanpur. From Brazil, Janice R. Ciasi Zanella, who is a veterinary researcher in the area of animal virology and Director General of Swine Poultry Research Center in Embapa, Brazil. From UK, Andrew Alexander Cunningham, who is a Deputy Director of Science in the Zoological Society of London. From Pakistan, Usman Dar, who is a consultant in global public health and director of One Health Project in UK Health Security Agency and Chatham House, Royal Institute of International Affairs. From Bangladesh, Nitish Devnath, team lead Fleming Fund Country Branch to Bangladesh. He is from DI Global LLC and One Health Bangladesh, National Coordinator. From DRC, Baptist Dungu, who is the Chief Executive Officer, On Health Support, Biological Products, SCC, OBP, South Africa. Next slide, please. From Sudan, Almobushar Parag, Senior Infectious Disease Epidemiologist, Head of Communicable Disease Control Program, Director One Health Projects from Qatar Ministry of Public Health. From China, George Fu Kao, Director General, Chinese Center for Disease Control and Prevention. From New Zealand, David Heyman, Professor of Infectious Disease Ecology from Massey University, New Zealand. From Uganda, Margaret Heitza, Professor of International Veterinary Epidemiology, Mississippi State University. From Netherlands, Marian PG Koopmans, Head of Department of Viroscience, Erasmus MC. From USA, Catherine Machalba, Senior Policy Advisor and Senior Scientist, EcoHealth Alliance. From Australia, John McKenzie, Emeritus Professor, Cochin University, Perth. From South Africa, Wanda Marketer, Professor, Center for Viral Zoonosis, University of Pretoria. From Germany, Thomas Mettenleiter, President of the Friedrich Loeffler Institute, Federal Research Institute for Animal Health, Germany. From France, Sergei Morant, Director of Research, CNRX, Montpellier University. From Russia, Vyacheslav Somlonsky, Deputy Head, Russian Federal Service for Surveillance on Consumer Rights and Human Well-being. From China, Li Shu, Chief of Branch of Emerging Infectious Disease from China CDC. So you can imagine these 26 experts are from developed and developing countries. They are from government and non-government. They're from academia. They're from NGO. They're from civil society. A very wide range of expert panel has been appointed on One Health high-level expert panel. And these recommendations will go to the 4 partners, that is FAO, OIE, WHO, and the UNEP. So very important development has occurred in the last 1 month. Next slide, please. Now we come to another important issue which has been highlighted by International Labour Organization and UNICEF. The issue is child labor. The World Day Against Child Labor, as you know, happened during the last 1 month. Child labor rises to 160 million, first increase in 2 decades. The International Labour Organization and UNICEF warn 9 million additional children at risk as a result of COVID-19 pandemic. The number of children in child labor has risen to 160 million worldwide, an increase of 8.2% 4 million children in the last 4 years, with millions more at risk due to impacts of COVID-19, according to a new report by the International Labour Organization, ILO, and UNICEF. The report is titled Child Labour, Global Estimates 2020, Trends and the Road Forward, released ahead of the World Day Against Child Labour on 12th of June. It warns that progress to end child labor has stalled for the first time in 20 years, reversing the previous downward trend that saw child labor fall by 94 million between 2000 and 2016. The report points to a significant rise in the number of children aged 5 to 11 years in child labor, who now account for just over half of the total global figure. The number of children aged 5 to 17 years in hazardous work, defined as work that is likely to harm their health, safety, or morals, has risen by 6.5 million to 79 million since 2016. Next slide, please. This is the cover page of the report, Child Labor, Global Estimates 2020, Trends and the Road Forward. Next slide. Worldwide, 160 million children are engaged in child labor. 79 million of them are performing hazardous work. Next slide. Sub-Saharan Africa stands out as the region with the highest prevalence and largest number of children in child labor. That is 23.9%. Central and Southern Asia, 5.5%. Eastern and Southeastern Asia, 6.2%. North Africa and Western Asia, 7.9%. Latin America and the Caribbean, 6%. And Europe and the Northern America, 2.3%. That is the situation which needs attention by all in the world. Looking at the global progress against child labor, if you look at the figure from 2016 to 2020, you find the trend has been reversed. If you look at the figure in hazardous work, from 4.6, it has gone up to 4.7. And also from, if you look at the child labor as such, it has also gone up from 151 to 160 million between 2016 and 2020. And if you look at all the left graph, every 4 years, the figure was going down, but it has gone up during the last 4 years, 2016 to 2020. Next slide, please. Hazardous work constitutes a sizable share of child labor among children aged 5 to 14 across all three sectors. That is sectors of agriculture, industry, and services. Hazardous work has been shown in red and non-hazardous has been shown in pink. 32.9% in agriculture, 64.8% in industry, 28.2% in services has been hazardous work, which is sizable share of child labor between 5 to 14 years. In all three sectors, highest in industry, but significant in services and agriculture also. Next slide. So we can easily understand the agriculture sector accounts for 70% of children in child labor, that is 112 million, followed by 20% in services, that is 31.4 million, and 10% in industry, that is 16.5 million. Nearly 28% of children between 5 and 11 years and 35% of children aged 12 to 14 years in child labor are out of school. Child labor is more prevalent among boys than girls at every age. When household chores performed for 21 hours or more each week are taken into account, the gender gap in child labor narrows. The prevalence of child labor in rural areas, 14%, is close to 3 times higher than in urban areas, that is 5%. Children in child labor are at risk of physical and mental harm. Child labor comprises children's education, restricting their rights and limiting their future opportunities, and leads to vicious intergenerational cycles of poverty and child labor. Next slide. To reverse the upward trend in child labor, the ILO and UNICEF are calling for 5 actions. Number 1, adequate social protection for all, including universal child benefits. Second, increased spending on free and good quality schooling and getting all children back to school, including children who were out of school before COVID-19. Promotion of decent work for adults, so families don't have to resort to children helping to generate family income. Number 4, an end to harmful gender norms and discrimination that influence child labor. And number 5, investment in child protection systems, agricultural development, rural public services, infrastructure, and livelihoods. So these 5 actions are urgently required by all the countries in the world, especially countries in Africa and Asia and South Asia. Next slide. Another important event which happened in the last 1 month has been the launch of the mobile application for yoga by World Health Organization. On 20th June 2021, WHO in collaboration with Government of India launched WHO M Yoga, a yoga application to help people stay active and healthy. The application is safe and secure and does not collect any data from users. It is available for free download on Android devices and Apple devices. The application contains a collection of video and audio files to teach and accompany yoga practice, and is an easy to use and free tool for both people who are trying yoga for the first time or those who already practice yoga regularly. No special equipment is needed, and users can learn or practice for between 3 to 45 minutes. So even busy people can use it to get active. The application was developed by Be Healthy, Be Mobile, a joint initiative between the World Health Organization and the International Telecommunication Union. Input from experts around the world was organized by the World Health Organization, Traditional, Complementary and Integrative Medicine Unit, and Modality Sci National Institute of Yoga, the WHO Collaborative Center for Traditional Medicine. WHO M Yoga was created in response to the Global Traditional Medicine Strategy 2014-2023, which aims to strengthen the quality, safety, and effectiveness of traditional and complementary medicine. As highlighted in WHO's Global Action Plan on Physical Activity 2018-2030, the routine practice of yoga, a 5,000-year-old tradition, is valuable tool for people of all ages to make physical activity an integral part of life and reach the level needed to promote good health. Adults require at least 150 minutes a week of moderate intensity activity. Regular physical activity is a well-established protective factor for the prevention and treatment of many non-communicable diseases and their risk factors, such as hypertension, overweight, and obesity. Physical activity is associated with improved mental health, prevention and delay of dementia, and improved quality of life and well-being. Next slide, please. This is the snapshot of Android application of WHO M Yoga application on Android devices. And there are screenshots at the bottom, the full screenshots of the application. So do consider downloading WHO M Yoga application from Android or Apple. Next slide, please. Yoga has been found to be effective in promoting health and is useful in improving the conditions of patients with cardiovascular diseases, stroke, diabetes, and mental disorders. It is recognized as a tool to promote physical activity and recognized as such by WHO. With support from the Ministry of Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy, Ministry of Ayush, Government of India, WHO is developing a benchmark document for training in yoga as part of its global strategy to strengthen the quality, safety, and effectiveness of traditional and complementary medicine. This partnership has gone from strength to strength, most recently with the development of the M Yoga application. This is an application for general public and for yoga teachers to use in their daily life and teaching. It includes WHO-approved yoga teaching and practice sessions of different duration, developed through extensive international expert consultation process. The application is safe and secure, collecting no data from users at all, and can be used as a daily yoga companion for persons aged 12 to 65 years. It will be available in all 6 UN languages and in Hindi. Presently, it is available in English at the moment. Next slide, please. The last issue which I would like to discuss in today's Occu Healthscapes session is about WHO Academy. WHO Academy is a tool for transforming lifelong learning for global health impact. A revolution is underway in adult learning, new and more effective methods of conveying knowledge and skills to working people, new technologies like artificial intelligence and virtual reality, experiential learning approaches that recognize what trainees already know while offering a more immersive, effective, and impactful learning experience. Technology fueled, driven by the latest science in how adults learn, these are the advancements that will empower the world's growing health workforce to build healthy societies and economies, and to lead the way towards fulfillment of the health-related sustainable development goals. A new focus on learning for impact and building competencies to make the world a healthier place. This is the thinking behind the World Health Organization's new WHO Academy, a state-of-the-art training institution that aims to bring the lifelong learning revolution to the health sector and reach 10 million learners around the world by 2023. As a center for delivering advanced digital and classroom training to health workers and others around the world, the WHO Academy will be a game changer for lifelong learning in health. Scheduled to launch its first online courses in 2021 and headquartered at a futuristic campus in Lyon in France, the Academy will be a globally accessible school for the future, combining the latest technologies in digital and remote learning with advancements in adult learning science to offer innovative, personalized, and multilingual training that meets priority needs. The WHO Academy is not a separate legal entity, but is being set up as an internal WHO division that will be headed by a chief learning officer at the level of a WHO Assistant Director General. The division will therefore be an integral part of WHO under the management authority of the Director General. Next slide, please. This is a snapshot of a survey which was done amongst health workers, and it found health workers want fast, reliable access on demand to the latest information on COVID-19. Health workers want to know more. 67% feel they need more skills to be fully prepared for COVID-19. Health workers look to WHO. 66% already use the WHO for guidance on COVID-19. Health workers prefer virtual learning. 7% say virtual learning on demand would help them respond to COVID-19. Health workers get their information on the go. When asked how they access the internet, 83% said through mobile, 51% said through laptop, and 33% said desktop. Specific areas where health workers feel they need to improve their skills on COVID-19, 42% said infection prevention and control, 41% case management, 40% use of personal protective equipment, 37% staff safety and health, and 31% on risk communication. So these are the 5 areas where health workers feel they need to improve their skills on COVID-19. Next slide, please. So, WHO Academy is also available as an application on the Play Store, on the Android devices. Just search for WHO Academy by the World Health Organization, and you will get this application and start learning on the go, on your mobile or PC or your laptop. Next slide. WHO Academy includes also occupational health for health workers. It would be useful for occupational health practitioners to participate in the testing. WHO Academy is going live soon with its first programs, and around 500 testers for the Academy platform application programs have been already chosen. Testing will be in Arabic, Chinese, English, French, and Spanish, and Russian. I am one of the testers for the WHO Academy, and in the months to come, the courses which are designed will be tested through these 500 testers from across the world. Next slide. So this completes the session on occupational environmental health issues which have happened during the last 1 month. We may have covered more, but we wanted to pick up key developments in the area of environmental and occupational health. And the end to this discussion will be through continued learning and updation through various sources of information that are available today across channels and across devices. Thank you so much for your patient listening. Any questions are welcome, or any discussion would be all the more welcome.
Thank you, Dr. Rajiv Jain, for once again for excellent presentation and information of latest occupational health issues around the world, and sharing lots of new knowledge about WHO, new application, and this academy. So the forum is now open for any discussions based on Dr. Rajiv Jain's presentation. I will request our senior member, Dr. Shyam Pingle, Dr. Shiva, office bearers of AOHD, Dr. Kamla Patia, Dr. Sandeep Sharma, and all the attendees share their views on the presentation or any discussion.
Thank you, Dr. Shiniket, and thank you, Dr. Rajiv Jain sir, for giving a wide spectrum of the occupational health issues, which were there over a period of 1 month, and especially, sir, e-waste management. That what you focus is very important for us in this current situation, because we all are now using all these mobile phones and lot of electronic gadgets and devices, but many of them they are being used for 1 year or 2 years, and then we find it difficult to how to dispose them of. So is there any guidelines in India to dispose the e-waste, especially our mobile phones and the like LCD, LED, or other electronic gadgets, sir? Some Indian policy is it there, sir, in place?
Well, yes, Dr. Sandeep, excellent question. And this was actually the issue which India has been progressing a lot in the past few years through public action, through judicial activism as well. If you had been keeping a watch on the newspapers, you must have found a notice by the Delhi Pollution Control Committee for registration and recycling of e-waste throughout Delhi. And similarly, the action by the state pollution control committees has been going on. And there are now recyclers available. And in fact, most of the manufacturers of electronic products are now collecting taking back the old product and now supplying you the new product. And they give value for the returned electronic product. Similar is the action in mobile phone. For laptop also, the major manufacturers are now in place who actually not only recover, they recover usable precious material, like I told you earlier, silver, gold, cadmium is also utilized, and these are all rare elements, but they are toxic as well. So these elements are recovered through recyclers and then used again, and this gives value to the product, next product which is going to be manufactured. So this ecosystem is developing. We as responsible users, or we as responsible managers, must understand that we need to help formalize the system of recycling. We need to ensure that organizations take up this as a challenge and as a project on the ground. Only then this area of recycling and reuse will increase, and we need to help this process through our organization and through individual and community action.
Thank you, sir. And can you, sir, throw some more light on how we can take the benefit of this WHO Academy?
Well, WHO Academy is simple. You go to the Google Play Store and download this application. And in any case, there are two other ways. WHO Academy is looking for experts. The last date for applying is till 31st of July. They will have experts from across the world. You can also, anybody from India can also apply. And WHO Academy needs a number of experts in different area of expertise. And those expertise and this area will get enlarged in the years to come. But current areas of interest of WHO Academy are listed in the WHO Academy. Just Google WHO Academy in WHO website and you will know more. The process of selecting experts is presently on, and applications will be accepted online till 31st of July. So there are a number of ways you can use the WHO Academy, and also the Academy will be launched formally in Lyon in sometime in September 2021 in France, and this will be expanding in the years to come. The Chief Learning Officer is in the process of being appointed, and application is working at the moment. You can download WHO Academy and start learning. And you can motivate your employees to also download this, to use this as a self-learning tool. And this will expand tremendously in the months and years to come. There's a major initiative, annual health assembly mentioned about it, and the resolution was passed on this account in the last World Health Assembly. And funding has also been provided. And France is hosting this institution, will be part of WHO Switzerland, the headquarters.
Sir, may I also request you, sir, you are deliberating on the occupational health issues over which had been there over a period of 1 month, and we discuss and you come out with the issues which are there and the events which are there over a period of 1 month. So in this regard, sir, since I am also National Secretary for Indian Association of Occupational Health, and we are affiliated to International Commission on Occupational Health, and we are also now aspiring to bid for this ICO 2027. So in this regard, sir, in addition to ICO Congress, which is held periodically, there are many other events of ICO, or there are many other initiatives of International Commission on Occupational Health. If we can include them also, so that at least the things which are being taken up by International Commission on Occupational Health, they can also be, we can become aware of that, and that will help in increasing our awareness about International Commission on Occupational Health. And the same way about Indian Association of Occupational Health, we are outreaching our members in different branches, and we are trying to hold periodic meetings of branch president and branch secretaries so that they are made aware of all the IOH activities, and we try to take them in our folds and try to make them aware that they are the part of our IOH family. So in this way, sir, may I request you from next episode onwards, sir, you can take some ICO activities also, because you keep an eye on all the occupational health activities across the globe. So the ICO activities, they can also be a part of the occupational health escape, sir. Thank you, sir.
Thank you, Dr. Sandeep. Actually, we have been doing that whenever, if you recollect, ICO brings out a quarterly newsletter, so that those issues are highlighted in the discussion during this Occuhealthscape as well. In October this year, there will be EPICO meeting. We shall be taking up few important deliberations issues during that month. In September, there will be an international conference in Canada, which will be online on safety and health at work, which also will be discussed in the relevant month. So we shall be expanding the scope of the Occuhealthscape to organizations and to institutions and to events and journals as well.
Yes,
We shall-
yeah, because we want to spread more awareness about International Commission on Occupational Health in Indian scenario amongst our occupational and industrial physicians, because that is we are affiliated to ICO, and we are also aspiring for this this ICO 2027. So rather than uh, rather than seeing ICO only by the lens of ICO Congress every 3 years. Rather, we should spread our activities across all the 3 years, and rather than sitting on the decorative positions, we should come out and contribute for spreading ICO messages in India. So.
Great, great. That should be the effort to bring synergies, to bring more partnerships, and to actual science of occupational health would be the focus. Thank you, Dr. Sandeep, for highlighting this issue.
Thank you. Thank you very much.
Anybody else? Like Dr. S.P. Chaudhary has raised his hand.
Yes, sir. Good evening, everyone. And again, very wonderful and mesmerizing session. And Jain sir, whatever topic takes, he gives so much details that we are speechless and we have to search what question to ask.
Thank you.
My question is this. Sir, there were reports that third world countries, including India, they have become dumping ground for disposing of biomedical e-waste and other kind of waste. What steps have been taken that our people don't deal with biomedical hazard waste materials of other countries?
Very important issue, Dr. Chaudhary, you highlighted. Thank you for highlighting this issue, and our government is alive to the situation of dumping e-waste, especially from other countries, and the law and enforcement agencies are keeping a watch on anti-dumping activity, and also ensuring that India is not used whether through offshore means or through on land routes for dumping of, especially which you're talking hazardous e-waste, which is harmful to our children. There's a number of institutions are in place, and number of mechanisms are in place through our customs authorities, which ensure that e-waste is not dumped in India.
But at present, they are dumped. The laws are not so effective.
At present, this is an area absolutely right, but the efforts are in place, and this will continue. The effort will continue, and I think the results are actually visible because of more formalization of our production processes and our import capacity. If we look at the Indian manufacturing base being large, the whole process of actually giving incentives for manufacturing in India is also focused on this area by only ensuring that raw material to finished products done in India to ensure that less of e-waste actually lands up in India.
So there is a principle of polluter pays. Has there been
Yes.
any clause to all these companies that whatever they try to dump, are they contributing something to dispose it of?
India has raised this issue at the international fora, and what has happened is that this area of negotiation at the international level is collective effort. The developing countries pay heavier price, and the developed countries actually use developing countries for dumping, giving more hazardous products to these countries at a higher price and earn more profits. So this area is actually being addressed at the international level at intergovernmental forums and other professional international agencies.
Thank you, sir.
One question by Dr. Damodar Leville was there, whether excess of BMW generated during COVID pandemic is being handled satisfactorily and to what extent. Thank you, Dr. Lele, for asking this question. If you had seen one slide I mentioned, only 88% of biomedical waste generated is treated. 12% is still not treated. So the effort should be on actually enlarging the scope of coverage of biomedical waste at the production place, and also ensuring that this is managed through authorized professionals in a very environmentally friendly manner. That effort is being done by the state pollution control committees and the central pollution control board. One question by Dr. Sanjeev Kulkarni was there in the chat I'm seeing. We all have e-waste, but not everyone is aware. At the same time, people who are aware don't really know where to do it. Any agency in Goa at the present. Yes, Dr. Kulkarni, you can easily find the recyclers from the manufacturers. Just contact the manufacturer. They will tell you not only the e-waste recyclers, names and addresses, many of the reputed e-waste electronic companies and PC manufacturing or mobile companies are now actually incurring the cost of collecting the old used product and also ensuring that this is given to official recognized which are ethical recyclers in that state, or they transport at their own cost. This is happening now by major brands in India, and this is expanding. And they're doing it not because they have to comply with laws, but they're doing it because they feel it is their responsibility, and also it gets them more profit because they earn the precious supplies through that e-waste material. Dr. Tyagaraja is there. Dr. Tyagaraja or Dr. Maruti would like to say anything? Your views on the issues that have been deliberated today?
Yeah, sir. Good evening, sir. Good evening, everyone.
Good evening.
It's really an eye-opening. So we are in the manufacturing center. Actually, there is a laws actually that we cannot dispose of things like that, and pollution control board is having a fully control that whatever the equipments we do purchase, that we have to give it during our audit, that how much we have been disposed and how we are disposing. But you touched on the personal usage, and Sandeep Sharma sir also asked that how we have to dispose the mobiles and our laptops and all those things. Actually, as you mentioned, sir, that we can go for the replacements and they will pay for it, and it's a huge value for them because a lot of the items which have been used can be recycled and reused. So that's a good advantage, and many people are coming across. In Bangalore, I'm seeing it's actually a lot of, they will take it back. It's a good point, sir, and it's reminding for us. Thank you, sir.
Thank you.
Two participants have raised their hands. They can ask the questions.
Dr. Akhilesh.
Hello.
Yeah, Dr. Akhilesh. Tell me.
Hello. Good evening, everyone. So it was really fantastic. I think this time we have gone ahead and expanded the sphere of where the involvements can be. It's really interesting you bring up the hazardous e-waste as well as the child labor. So what I would think from my perspective at this point of time is we do have a very strong logistics vis-a-vis Amazon, Flipkart, all these agencies have very strong logistics. There is incentive to the private agencies and the government to make this a very strong area. However, now that we have opened the Pandora's box, I really think this comes in the purview of Indian Association for Occupational Health to push for the reforms on this front. Why? Because first thing, as sir was saying, there is a dumpers fee that could be a nominal charge that could be charged for all the electronics industries, because they have all planned obsolescence of the electronic gadgets, and our consumption will increase and we will go for this capitalistic model, and we'll have plenty of electronic waste in the future. So one is nominal fee, and second thing is maybe you can as a association you can push for reverse logistics, incentivizing the reverse logistics or taxing the reverse logistics and creating an efficient reverse logistics systems. Why this would be very important is this would definitely come under the purview of occupational health. Why? Because if the number of hazardous material are reduced in terms of unorganized sector, the child labor, it will impact the child labor. So I think now I just think as a team you could propose your involvement in lobbying for strengthening the reverse logistics in terms of doing the study or providing a public private partnership sort of model or sort of innovative ideas to the government. So that's what I feel from my end, sir. So your comments on this, please.
Dr. Sandeep Sharma would like to say, I think that he's the right person to.
No, that's right. We will definitely take your suggestion in our forum, and we will definitely take up these issues and take it forward. Thank you for the suggestion, and yes, we should pen down all these issues which will help us in taking our issues forward with the government and with the community. Definitely, this will help us.
We already have e-waste rule for the industries. So like I know about my company and other companies. So everybody has to follow the e-waste rule, which comes under all the environmental rules. So the disposal and all the things are governed by those rules only. And as we have been discussing, that many companies are promoting this collecting e-waste from door to door. So we have to just search them on Google and then we can take their services. Some companies may provide some amount on their collecting the e-waste also, but most of them are not giving any amount, but they are collecting our e-waste. So we can have their services instead of disposing in the normal garbage or other things. We should dispose it properly. This is our responsibility also.
So, Dr. Shinikat, it is a community responsibility. We should make more awareness amongst the community people how to dispose of the e-waste, because rather than accumulating all the electronic gadgets in your drawers, it is better to, as Dr. Maruti suggested, you better give it in a buyback scheme, or you dispose of as per the law of the land. That is more important. And this will definitely reduce the hazardous waste burden, and it will definitely impact the labor and child labor issues also, as Dr. Ashish has elaborated. We will take up the issues definitely.
The issue which I had highlighted in the presentation, and WHO as a collective intergovernmental body had highlighted, was the harm that it is causing to the health of children, and that harm is lifelong harm. And this e-waste through informal channels is how it is affecting the life of children all the more, because they are these, if you look at all the dumping sites and the informal ways of segregating the combined waste in any city for that matter, you will find children are doing the segregation through dumping sites, and they don't wear any gloves or shoes, and they're hardly wearing any clothes also. So that harm is a lifelong harm to the society. That harm needs to be understood, and then e-waste management system will improve. The percentage of informal versus formal is very high in India at the moment. Informal is very high. We need to transfer this informal to formal e-waste recycling. That is the focus these days, because of simple reasons that we are actually dumping precious rare earth material which India cannot produce. All this rare earth material which are used in our mobile phones and laptops is precious material, and that is why India has to pay a lot, and India is not able to manufacture. We have to invite manufacturers from outside to manufacture these products. There are a number of issues involved. So unless we do formalize the recycling process, it will not become economic activity. And only through economic activity, the harm to children will be prevented. So that is how our Occupational Health Association would be useful platform to advocate with the, in fact, the state bodies, with their respective state governments. If they advocate these issues, the change will come on the ground.
So my request is to make it as attractive as possible to channel the funds to from the for lobbying from your end, to make it very attractive so that the formal sector collects most of this, just like how we get this Amazon or Flipkart. It should go back. Like I have covers, I have these ones. Today I don't have any channel to give back. So I think what I would request is to make a strong case to allocate the funds in public-private partnership model. That's just one angle, but it should be as attractive as possible in terms of marketability and such things. Yeah.
So I think we had a very good discussion and excellent information sharing by Dr. Rajiv Kumar Jain. And if we focus on the environmental health issues and the public health issues, then we can reduce the disease burden on our populations, and we will have a more healthy population. So instead of making more hospitals and more super specialty hospitals, I think our health authorities and government should focus on these environmental issues more. And if this prevention is there, then the diseases will be less, and the cost of prevention less than the treatment. So I think our government should focus on these environmental and pollution issues more, so we will have a healthier population. With I think if we don't have any more questions, we can close this session, conclude this session. And I will once again thanks Dr. Rajiv Kumar Jain.
Thank you so much. Thank you.
Good evening, good night, everyone.